So good day po, I am Ricardo Eirol Lirio. I am your nurse for today. So may I ask po what is your name, your birthday, and your MR number?
My name is Lord Antiporda,
Mhm.
and my birthday is November 6, 2013, and my MR number is 123.
So okay po, so Miss Xena, for today po, I am going to assess your breast and your lymphatic system. And we do this po to identify risk factors associated to breast cancer across the culture and ways to reduce the risk po. And for us also to identify or differentiate the different normal and abnormal findings po na makikita natin sa breast at sa inyong lymphatic system. But before doing anything else, do you want some privacy po? Should I close the windows? Okay. So, should I be aware of any cultural sensitivity po such as religious beliefs, personal beliefs po? Wala naman po. Okay, so before anything else, I will do a hand hygiene or hand washing. And of course, the donning of my personal protective equipment. So first is the hand hygiene. There are 5 moments of hand hygiene. First is before touching a patient. Next is after touching a patient. Next is after before doing a procedure. Next is after doing a procedure. And next is after being exposed to any bodily fluids or the surrounding po nating patient. So now that I am done with some hand hygiene and hand washing, I will now don my personal protective equipment such as the gown, the mask, the cap, the goggles, and the clean gloves. So now that I am done with hand washing and donning the personal protective equipment, I can now gather all of the equipments needed po sa ating procedure. Okay. Now that all of the things gather and within reach, I can now ask if meron po ba kayong any medical history po, such as sa breast na operahan na po ba kayo sa breast? Any past feeling po na masakit po sa breast, sa lymphatic system? Wala naman po. Okay, good. So anything na nasa medical record, wala naman po tayo in terms of breast and lymphatic systems. So before doing any procedure po naman po is we ask the patient if she will allow us to inspect and palpate her breast as part of the assessment. So will you allow me po to inspect and palpate your breast? Okay, thank you po. So let us now move on to the general inspection. In the typical assessment of the breast po, we will ask the patient to undress behind the curtains and up down to the waist po. But in this assessment, to ensure the privacy of the patient model, we will use a breast printout po for us to still showcase the inspection and the palpation of the breast. So now we will ask the patient to sit upright with hands relaxed on thighs, like upright like this. We will now inspect the breast and we will take note of the following. First po is the size and the symmetry. So it is normal to have asymmetrical chest for women, but if yung hindi pantay po nila is sudden, we can ask the patient about it. So ma'am, normal naman po na asymmetrical po ang ating breast po, no? Wala naman pong sudden changes po sa size niya. Wala naman po. Okay, so normal naman po ang symmetry ng size ng breast ng ating patient. So next naman po is the shape. So typically the shape of the breast po is round and makita naman po sa breast ng ating patient, it is round. So now naman po we will inspect the color and the shape of the breast ng ating patient. The normal color po ng breast ng ating patient must be lighter than the exposed color ng kanyang skin such as the arm. So makita naman po natin if we compare it is mas lighter ang color ng breast niya kaysa sa arm which is normal naman po. Now for the texture, we will inspect for some lesions, some lumps, and some masses, and of course some dimpling. Since if there are signs of dimpling, it can be a serious form of cancer or some inflammatory breast cancer. So now I'm inspecting your breast po for some lesions, masses, and of course some dimplings po. So, mula naman po, so ang ating color and texture is clear. So now naman po, we will inspect the superficial venous pattern po ng breast ng ating patient. Ito po yung mga ugat sa breast ng ating patient. So normally po, dapat po wala siyang ganon unless ang ating patient ay pregnant or meron po siyang blood clotting or problem sa kanyang vein sa may breast. So if meron pong ganon, we will take note of that since it can be a sign of any conditions na dapat po ikabahala natin. As we can see, wala naman pong siyang superficial venous pattern, so that is good. So last but not the least naman po sa inspection is the inspection of the areolas and the nipples po na ating patient. So we will check if her areolas and nipples are deviated, such as if there are nipple changes po doon, such as retractions, visible discharges, and alterations such as sugat. So ito po ang kanyang areola and this is the nipples. So as you can see naman po, there are no visible discharges, wala pong retraction, and especially wala po siyang alterations and sugat. So which is good and we will take note na normal naman po ang pagkaka-inspect natin sa areolas and nipples ng ating patient. We will now continue to the palpation ng ating breast. So we will do this in a systematic approach or in a circular manner. First po is we will palpate for the texture and elasticity. So to do this po, we can palpate the patient's chest or breast in a circular motion that typically lasts for 3 minutes. Per breast po ang 3 minutes na yun. So we will start with the areola and then going outward po. So we will now palpate it and check for some texture and elasticity. So from the areola, outward po in a circular motion. Okay? On the other side naman po. Okay. The normal findings po of the texture and elasticity po ay dapat po ang areolas po natin ay bumpy while the overall chest po natin is smooth. Then also we can take note of the elasticity of the areola. So sa pagkakapalpate ko naman po sa kanya areola, it is a little bit bumpy while sa chest naman po is smooth. So wala po tayo dapat kabahala sa texture and elasticity po ng ating patient's breast. Let us now move on with the palpation of the tenderness and temperature po ng breast ng ating patient. We will do this again in a circular motion po ulit in our patient's both breast po. For the temperature, we can use the dorsal or the back part of our hands to measure the temperature. So now we will do it po. Circular motion, palpation. Okay, so now for the temperature is the back of our hand or dorsal. Okay. Okay, so it is normal po for the breast to be warm, but if it is so hot and above normal, it can be a sign of mastitis or the inflammation of the breast tissue po ng ating patient. And if meron pong ganon, we will take note of that. Pero as I've checked naman po sa temperature ng breast ng ating patient, it is in a normal warm temperature range and not in a super hot or above normal temperature. So, which is good. Okay, so let us now move on to the last part of the palpation ng breast, which is we will now palpate the masses or for some masses. It is normal to have masses sa breast ng patient because it is usually benign or not cancerous. But if we palpate it and it feels abnormal or malaki po siya masyado, we can refer here po to the mammogram or breast ultrasound or x-ray to check if meron po siyang any cancerous masses na something to worried about. But let us check if meron po siyang masses like that. Again, palpate in a circular motion. Okay. Okay, so there are no any abnormal masses naman po tayo na feel sa patient's breast, which is good. And we will take note of that since that is a good assessment po ng ating patient's breast. And no masses na dapat ikabahala. So we are now in the last part of the assessment of the breast and the lymphatic system, which is the inspection and the palpation of the axillary. So for information po, there are 5 lymph nodes sa ating breast, namely axillary, supraclavicular, intraclavicular, the pectoral, and the internal. But for today's assessment po, we will assess the axillary lymph nodes. So there are 5 lymph nodes po natin ipapalpate sa ating axillary ng patient, which is the lateral, subcapular, pectoral, apical, and the central. And we will take note if it is swollen po, since a swollen lymph node is also called a lymphadenopathy, and we will take note po if meron po siyang ganon. So, first is the inspection. Raise po ng hand. Okay. Next naman po is the palpation. First po is the lateral. Okay. The subcapular. The pectoral. Okay. The central and the apical. Okay. So as I check naman po, there are no swelling po sa kanyang lymph node. But to be clear, let us verify the patient if meron po siyang na-feel na pain while we palpate her lymph node. So meron po ba kayo na-feel na any pain while palpating the lymph node? Wala naman po. So good. So now we are done with the assessing of the lymph nodes. So we are done with the overall assessment po ng ating breast and the lymphatic system. So we will now all document all pertinent information na kailangan sa ating nursing forms. And now we will discuss the patient, the holistic nursing care, which involves not only your physical aspect but also your emotional, psychological, spiritual, and yun po. So, always remember na hindi lang po kami nakafocus sa pagpapagaling sa inyong physical aspect but also your emotional, spiritual, psychological. So, that's all po. Thank you po.